Hello and congratulations on your retirement after your many years of service. If you and/or your eligible dependent are eligible for Medicare and are currently enrolled in both Medicare Parts A and B, you have additional options for your retiree health care. There are several LACERA-administered Medicare Advantage prescription drug plans to choose from, and a Medicare Supplement Plan, Anthem Blue Cross Plan 3, Indemnity Plan. If you are under Tier 2, for those hired on or after July 1, 2014, enrollment in Medicare Parts A and B is mandatory. We created this step-by-step video to help you complete the enrollment form used to apply for a LACERA-administered Medicare Advantage Prescription Drug Plan, or MAPD for short. Following are a few scenarios and instructions to make sure you and/or your eligible dependent are completing the correct paperwork. If you and/or your eligible dependent are enrolling in or changing to the Medicare Supplement Plan, Anthem Blue Cross Plan 3, you do not need to complete an MAPD form. You need to complete the Medical Plan New Enrollment Form. If you and your eligible dependent are already enrolled in a LACERA-administered group non-Medicare medical plan and will be turning age 65 and will be enrolling in an MAPD plan, you only need to complete the MAPD form. If you are a new retiree and enrolling in a LACERA-administered group medical plan for the first time and are age 65 and above with Medicare Part A and B, or are under age 65 with Medicare Parts A and B, you need to complete both the Medical Plan New Enrollment Form and the MAPD form. To access the Medical Plan New Enrollment Form, click the Retiree Healthcare tab on LACERA.com. Manage your enrollment, Retiree Healthcare Forms and Publications, Medicare Advantage Prescription Drug Plan Enrollment Form. If you and/or your eligible dependent are turning age 65 and are currently enrolled in a non-Medicare plan, LACERA will send you a Turning Age 65 letter approximately 3 months before your 65th birthday. It is important to read the letter and follow the instructions. Check the due dates listed on the letter and be sure to submit your enrollment forms and the required documentations to LACERA to avoid delay or avoid the 6 months waiting period. Contact the Social Security Administration, SSA, to sign up for Medicare, or find out if you and/or your eligible dependent are eligible for Medicare. To help you fill out your form completely and accurately, we have created a sample form and instructions that we will reference throughout this video. To access it, visit LACERA.com, click on the Retiree Healthcare tab, Manage your enrollment, Retiree Healthcare Forms and Publications. Under Enrollment, Change Cancellation Forms, find the enrollment instructions and sample form for the Medicare Advantage Prescription Drug Plan Enrollment Form. Read through the enrollment sample instructions page and gather the information, documents, and ID cards you will need to fill out your form. Types of medical plans. LACERA offers the following Medicare Advantage prescription drug MAPD plans based on service area availability. Kaiser Permanente Senior Advantage in the following states: California, Colorado, Georgia, Hawaii, Oregon, and Washington. United Healthcare Medicare Advantage. Cigna Preferred with Prescription, HMO, available in Maricopa County and Apache Junction, Pinal County, and Arizona only. Scan Health Plan, available in certain counties in California, Arizona, and Nevada. An MAPD HMO plan is an HMO that has a contract with the federal government to provide healthcare services to those with Medicare Part A and Part B coverage. Medicare, the federal government, in turn, pays the HMO a monthly fee for each member. To participate in this plan, you must agree to receive all medical services and prescription drugs from plan providers, accept emergency care while traveling outside the HMO's service area, and assign all Medicare benefits to the MAPD HMO. As a reminder, do not enroll in a non-LACERA-administered MAPD plan, as this may jeopardize your enrollment coverage. Contact LACERA first. To learn more about the available MAPD plans, visit LACERA.com, Retiree Healthcare, Medicare, Comparison of Medical Plans, Medicare. To better understand how your LACERA healthcare benefits work together with Medicare, watch the Intro to Retiree Healthcare and Medicare video by going to LACERA.com, clicking on the Resource Center tile, and then selecting Video Library. How to complete your form. Okay, are you ready to begin? Here are the steps for enrolling in a LACERA-administered group Medicare Advantage prescription drug plan, MAPD. Remember, you must have both Medicare Part A and Part B to join a Medicare Advantage plan. If you and your Medicare-eligible dependent are both enrolling, you must each complete a separate MAPD form. Start by using the blank Medicare Advantage prescription drug plan enrollment form that was sent to you or downloaded from the Retiree Healthcare Forms and Publications page. You can skip the gray section, as that is for LACERA use only. Select the correct box to signify who is completing the form. Enter your retirement date, and check the correct box for your marital status. In Section 1, you'll supply basic personal information. Please provide all the information requested, as it is all required for enrollment. The first field is auto-filled as LACERA, since this is a LACERA-administered MAPD plan. Once you have completed filling out your personal information, answer yes or no to the question, "Are you the subscriber?" The subscriber is the retiree or survivor. Next, provide your Medicare insurance information, including your name as it appears on your Medicare card, your Medicare number, and the effective dates of Part A and Part B. Starting at the top of page 2, and for every following page, you will need to print your entire name and Social Security number. In Section 2, answer questions 1 through 5 and provide any requested information. These questions are as follows. Are you the retiree? Are you covering a spouse or dependents under this employer plan? Do you or your spouse work? Will you have other prescription drug coverage? Are you a resident in a long-term care facility, such as a nursing home? In Section 3, carefully review the arbitration agreement for your selected healthcare plan, then sign and date below. If enrolling in a United Healthcare Medicare Advantage, Cigna Preferred with Prescription, or Scan Health Plan, sign and date at the bottom of page 4. If enrolling in a Kaiser Foundation Health Plan, sign and date the appropriate line on page 5. Note that if you're enrolling in a Kaiser Hawaii plan, you will need to sign and date the specific arbitration agreement included. For California and all other out-of-state Kaiser plans, sign the arbitration agreement for California. In Section 4, select the MAPD plan you will be enrolling in and fill in the requested information. For questions about physician and/or medical group selections, contact the carrier or visit their website. Plan carrier contact information and websites can be found on LACERA.com, Retiree Healthcare, Healthcare Plans. You're almost done. In Section 5, you will need to carefully read, initial, date, and sign the authorization agreement for your chosen plan. Submitting your form. Once you've filled out your form, give it a quick double check and make sure it is complete, accurate, legible, signed, and dated. If we receive your form and it's missing information, we won't be able to process it in a timely manner, and we'll need to follow up with you, causing a delay in processing your enrollment that may affect the effective date of your healthcare coverage. If you are filling this form out on your computer, you will need to print it out to sign it. Remember to keep a print or digital copy of your completed form for your records. If you are a new retiree, we recommend submitting your healthcare enrollment forms and all the required supporting documents at the same time as your other retirement paperwork. That way, you'll have a seamless transition to your new retiree healthcare plan. New retirees have 60 days from their retirement date or when their name appears on the Board of Retirement agenda, whichever is later, to submit their healthcare enrollment forms. If submitted beyond the 60 days, enrollment will be subject to the 6-month waiting period for medical. For instructions on how to submit your form and documentation, refer to the instructions page of the sample form. We recommend you scan and upload your forms to MyLACERA via LACERA.com, as this is the fastest and most secure method of submission. You need to submit all numbered pages of your form and all required documentation for timely processing of your enrollment. LACERA will notify you if additional information is needed. Please respond to the request immediately to avoid a delay in processing your enrollment forms for coverage. A delay in processing may affect your effective healthcare coverage date and/or cause your enrollment to be subject to the 6-month waiting period. Sign all required areas and answer all questions. Contact the Social Security Administration to sign up for Medicare or find out if you and/or your eligible dependent qualify for Medicare. It's important to sign up promptly to avoid gaps in coverage or late enrollment penalties. You will receive your ID cards directly from the insurance carrier within 7 to 10 business days, as they send the ID cards, not LACERA. If you have questions or need assistance with your ID cards or claims information, contact the carrier. You can also view or download your ID cards by registering or logging in to the carrier's website. Visit LACERA.com, click on Retiree Healthcare, and then Healthcare Plans for carriers and their contact information and websites. How to contact us. Your welfare is important to us, and we understand that Medicare is complex. We're here to provide any enrollment assistance that you need. Contact us if you have questions about LACERA-administered Medicare plans, or for assistance completing your and/or your eligible dependent's MAPD plan enrollment form. Contact SSA if you have questions about signing up for Medicare Part A and B, Medicare premiums, or to see if you're eligible for Medicare. Call us at 800-786-6464, Monday through Friday, excluding holidays, 7 a.m. to 5:30 p.m. Pacific Time, and follow the prompts for the Retiree Healthcare Division. Send a secure message through My LACERA, the fastest and most secure method, and you will automatically receive a confirmation of receipt. Email us at healthcare@lacera.com for general information only, or visit lacera.com and click on the Retiree Healthcare tab. Have a long and healthy retirement.